Welcome back to Sushruta Hospital Health Talk. Today we are talking about one of the most remarkable procedures in reconstructive surgery, limb reimplantation. First off, many listeners want to know what exactly is limb reimplantation, madam?
Sure, it's the surgical reattachment of a fully severed body part, like a finger, hand, arm, foot, or leg. The goal is to restore as much blood flow, sensation, and motion as possible after a traumatic amputation.
What kinds of injuries lead to this? Are we talking just accidents with saws or machines?
Yes, a range of trauma can cause amputations that might be eligible for reimplantation, industrial accidents like chainsaws, cutting machines, lathe, or agricultural machinery. Road and railway injuries with severe limb detachment, animal attacks that cause extreme tissue loss. All these can result in a completely severed limb that might be considered for reattachment.
If someone loses a limb in an accident, patients often ask, can it just be put back on if we hurry?
It's not as simple as putting it back on. You need emergency microsurgery to reconnect bones, blood vessels, nerves, muscles, and skin under a microscope. Without restoring blood flow, the limb not only fails, it can decay or die because tissues don't get oxygen.
What about time? How fast does surgery need to happen?
Time is critical. The sooner the limb is reattached, ideally within hours, the better the survival. Sometimes, even beyond the golden hours, skilled teams have succeeded, especially with rapid coordination and preservation.
And a big question, will the limb work like it did before?
Expectations matter. Even with a successful reimplantation, the limb often doesn't return to 100% function. Nerves grow slowly, maybe about a millimeter a day, so full sensation can take months or years. The repaired limb may have stiffness, reduced strength, cold sensitivity, or altered sensation, but recovery can be very meaningful.
What are the risks and challenges patients should know about?
As with any major surgery, infection and wound issues, blood clotting problems in the repaired vessels, incomplete nerve recovery and limited motion, emotional and psychological stress during recovery.
Finally, any advice for someone facing this scenario?
Focus on quick action, preserving the severed part properly, and staying informed. Ask your surgical team about timelines, expected outcomes, and rehab plans. Outcomes are best when patients work closely with their care teams.
Thank you for breaking this down, MAM. If you or someone you know is dealing with trauma like this, talk to a specialist. Every case is unique. Keep watching Sushruta Health Talk and stay healthy. Follow our social media handles for more information. Thanks for watching.